sensitivity would be pretty valuable, right? So somebody is developing a test. They gather up 100 subjects that they know are sensitive to nickel, right? And they use this test on them. Now, this test in this 100 population of 100 people that are sensitive to nickel, 80% of the time, the test catches that sensitivity to get a positive result on the test. That percentage, the probability that that you detect the disease in a person who has it, is called the, anybody know? You talked about it in the lecture. No, it's sensitivity. The sensitivity of the test is the probability that you get a positive outcome if you have the disease, the sensitivity, or whatever it might be. So if you have 100 people with nickel sensitivity, you expect that test is going to identify 80 out of those 100 people. What happens to the other 20 people? They tested negative, even though they have that sensitivity. What do you call those? No, what do you call those people? Those are false negatives, right? They had the disease, but they tested negatives. Those are false negatives. What do you call the people that were correctly identified as having the disease? Those are true positives. So we have true positives and we have false negatives. All of those people tested positive, right? If a person with a disease tests positive, he's a true positive. If he tests negative, he's a false negative. Okay, so now most of the population doesn't have a nickel sensitivity. Okay, they test it out on people that they know don't have a nickel sensitivity, and they find that 90% of the time that it correctly identifies people that don't have, you get a negative result if a person isn't sensitive to nickel. What shall we call that? That's called the specificity of the test. The specificity is the probability that it will correctly identify people who don't have the disease. In other words, you'll get a negative. So those people that correctly identify, say out of 100 that don't have the disease, those people, the 90 that it identifies correctly, are called true negatives. And the 10 people that it falsely diagnoses positively as having the disease are called false positives. Good. Okay, well, we got a chart over here where if you look at the chart, I'm going to blow that up a bit more. If you look at the chart there, you can see, let's get the chart in the picture. You can see I'm going to draw a contingency table basically, right? It looks very similar to the tables that we started talking about at one point or another that we call contingency tables. In the rows, I'm going to put the outcome of the diagnostic test. In the columns, I'm going to put whether the person actually has the condition or disease, right? So sometimes you'll see me indicate a positive test with a T with a plus, and a negative test is a T with a negative, and disease is a D with a positive, and no disease as a D with a negative. Okay, so in our case, the sensitivity to nickel is our disease. So in the rows, we have people that got a positive test and negative test. In the columns, we have people that actually are sensitive, have the disease, or people that are not sensitive. In this population, right, this is a population that has a high sensitivity to nickel. And we know that in this population, 80% of the population, 20% of the population has a nickel sensitivity. Okay, so here's our chart back here. 80% of the population has nickel sensitivity. I'm going to construct a chart that I think, given what we know about this test, the sensitivity and specificity, we've been told what it is because it's based on prior studies, and we know the prevalence in the population. I'm going to fill in this chart for a typical population. I'm going to pick up population numbers, population size, that is going to give me round numbers if I start like the breaking things up. In this case, I took 1,000. Okay, so I have a population of 1,000 people, right? You can see it in this first chart. Okay, so now I'm going to take a look at that population of 1,000. if the prevalence is 80%, 20%, that means out of that population of 1,000, how many people have a nickel sensitivity? 200, right? 20% of 1,000 have a nickel sensitivity. And if you look, the columns here, the column on the left represents they have the disease. So I'm going to put that 200 at the bottom because that's going to be where all those people are. They all have the disease. People that don't have the disease are in the next column, not sensitive, and there's 800 of them. Of course, they add up to 1,000. 200 of them are nickel sensitive, 800 are not, out of a population of 1,000, hence the prevalence of 20%. Okay, so now we decided 200 people in this population are sensitive to nickel. What was our sensitivity? How good was our test at identifying those people? It was 80%, right? Sensitivity was 80%. So we're going to correctly identify 80% of those 200 people, which is how many people? And where does that 160 go? That goes into the true positives, right? 160 people are correctly identified as having the disease. So how many people are false negatives? 40. So everybody in this first column has the disease. Only the 160 tested positive, though. Okay, let's look at the people that are not sensitive to nickel. Okay, what did we say the specificity of this disease, of this test was? 90%. So 90% of the time it's going to correctly identify those people as not having the disease. So 90% of 800 is 720. So what does that leave for the number of people that it incorrectly identifies as positive? How much? 80. Okay, good. So let's see, what's the total number of people out of this 1,000 that tested positive? 240, right? A little tricky, right? Once you get used to these tables, it'll be a lot less tricky. What's the total number of people that tested negative? 760. Good. Okay, so now 240 people tested positive, right? Out of those 200, and you're one of those 240 people. Out of those 240 people that tested positive, right? 240 tests. Out of those, how many of them really are positive? Right. So out of those 240 people, what's the probability that any individual in that group of 240 people really has the nickel sensitivity? That's 160. Good. 160 over 240. Right. Okay. I'm going to phrase that another way. I'm going to say, what's the probability of having the disease given that, and what's the given here? That you tested positive, T plus, right? That's a well, on the keyboard it's called a pipe, and on my keyboard it's above the backward slash on the right hand side. I think on some keyboards it's like over the one or in the left hand side or something like that. That's called the name of that character is called a pipe, but it means given that for our purposes. So that notation says the probability that you have the disease given that you've tested positive, and that's equal to 67%. Right? Roughly. Okay. So in other words, if you tested positive, whoa, that doesn't mean you have the disease. Because 33% of the people that test positive don't have a nickel sensitivity. Right. So this tells us how likely it is you have the disease given that you've tested positive. What's a good name for that? That's the value of a positive test. It's the positive predictive value. Okay. Okay. I'm gonna ask you now for you to tell me. Let's say, what's the value of a negative test? What's a good name for the value of a negative test? Negative predictive value, right? What's a negative predictive value for this test in this population? Okay. Well, how many people tested negative? 760. How many times was it right? How many people actually had the disease? 720. So the negative predictive value is 720 over 760, which is what, about 90% or 92% or something like that. 94.7%. That's our negative predictive value. There are some people that test negative that do have the disease, but this test didn't catch them. Right, the specificity and given the sensitivity and specificity and the prevalence. Notice I always preface it with this test applied to this population. We're going to take now that's a conditional probability, right? Now we've come full circle. We worked with coins, we worked with test results, we worked with populations, divorced and undivorced, or male or female, and so on and so forth. Now we're working with a diagnostic test. We're applying the same principle of conditional probability, right? Really, this thing called Bayes theorem. Okay, we're going to get back to, we're going to play around with that a little bit in a moment. So now, again, I mentioned that that's for this population. Now let's do this again, except we're going to do it for a population that has a 1% prevalence instead of a 20% prevalence. Okay, so I'm going to take the same number I started with, my pseudo population of 1,000. And but you know, this isn't the way everybody does this. I like to do it this way because I think it makes it kind of clear. You know, and if you're stuck on a test trying to remember this stuff, sometimes given if you know the specificity and the sensitivity and the prevalence and so, you can kind of build this table yourself by picking an easy population number, 1,000. If you got like fractions and stuff like that, sensitivity is 82.1. You might try 10,000 just to keep it whole numbers and so on. So I picked 1,000. So if the prevalence is 1%, how many of those people out of that 1,000 actually have the disease? That's 10%. 10. Only 10, right? How many don't have it? Okay. So now, same test. Test hasn't changed. Sensitivity is 80%. Out of those 10 people, how many of them we get right? 8. Okay, true positives is 8. How many we get wrong? False positives is 2. False negatives is 2, rather. Like I said, the more you talk, the more jumbled up you get. Okay, so now, so you got 990 people that are not sensitive in this population to nickel. Our sensitivity, we're going to get it right 90% of the time. How many people does of those 990 test negative?
Sensitivity is 80%?
90. The sensitivity is 80. The specificity is 90%. So we're gonna get it right. We're actually gonna get a negative test 90% of the time for these 990 people. So what's 90% of 990? 891, right? Am I right? Okay. What does that leave for people that tested positive because the specificity was 90%? 99, 10% of the 990, obviously, right? Okay, so how many people test positive? Okay, how many people test negative? 893, right? Right, total, everybody in that row is negative, right? Okay, so now what's our positive predictive value? How many people tested positive? 107 tested positive. 107 people out of that population. Do you see it there? I don't know if you can see me highlighting that. Yes, you can. Okay. 107 people, this whole row tested positive, right? Out of those 107 people, how many people actually have the disease? 8. So let's use our formula again. I'm going to do it down here. So the probability of having the disease, given that you've tested positive, right? What does that equal to? That's equal to 8 out of 107 people. So what's our positive predictive value? 107. Any guesses? 8 out of 107, what is that? 7%. Okay. So 93% of the time, a positive test, if you get a positive test, the chances are 93% of the time, you won't have the disease, even though you got a positive test. Right? What changed? The specificity was the same. The sensitivity was the same. What changed to give us such a crummy positive predictive value? The prevalence is the only thing that changed. We're applying the same test to a population that has a much lower prevalence for that disease. So that means you're testing a lot of people that don't have the disease. So it piles up those false positives on you. Can anybody think of tests where you test like a large population, there's a low prevalence of the disease, so you get a lot of false positives and hence a low positive predictive value? Give me a couple.
Gluten.
What's that?
Gluten sensitivity.
I don't, is it? I don't know. I guess it is, right? Yeah, Hep C, I guess, right? Although, I'm sure your screening test, your screening test, maybe. How about PSAs for prostate cancer? The sensitivity for prostate PSAs for prostate cancer, I'm told if you use the cutoff for, whatever it is, cutoff for, or something like that, it's something like 20 or 30%. And the specificity is like also pretty low. And you test a lot of people. And a lot of people wind up having biopsies and other exams and so on and so forth for benign prostate conditions because the PSA suggests that they might have prostate cancer. Right? And it's a large population because everybody over 50 is getting tested. Right? Sometimes even younger if you have a history. How about another one? How about uterine cancer? Right? Pap smears, same way. Right? You have a low prevalence disease, a relatively uncommon cancer, right? And you test everybody. You go to a doctor now, you're a certain age, a female, just like a male, he's going to want to do a pap smear. And, even with a test that has a reasonable specificity and sensitivity, if you test a big population, if you test the entire population and it's a relatively low prevalence disease, you're going to get a lot of false positives. Right? So you see why. I mean, you just demonstrated for yourself why that occurs. Yes?
It's not that the different type of population actually changes the outcome of the false negative. It's just percentages wise, right? Like relatively, you're going to get higher percentages of false positives.
Right. The test works just as good. Test works exactly the same. The problem is that because you have so many people that don't have the disease, even though the probability that you're going to misdiagnose them is still only 10%, remember, because our specificity is 10. Now you're taking 10% misdiagnosis of a much bigger population, right? So the fact that it's a low prevalence means that you have more people that don't have the disease, so you can get it wrong. You can get false positives more frequently, right? So you can kind of look at these numbers. You can play around with these numbers and kind of maybe it'll kind of make sense to you a little bit. Okay, let me see. I'm gonna do another example of this. Oh, I shouldn't have closed that. Let me reopen that. And maybe it's on the desktop here. Desktop here. Okay, get another clean piece of paper. Let me get my notes here. Okay. Okay, I'm going to look at the same problem, slightly different perspective. Okay, so what's that? Yeah, positive. We figured out the positive predictive value, right? Let me go back to it. No, we didn't bother with that. You want to take a look at it? Yeah. Okay. Let's see if that. Let's see if that changes. Did I close the whole thing? Maybe it's still open here somewhere. Nope, I don't see it. I don't have it open. All right, just have to open it from scratch. Okay, let's go back here. And we had 10 here. We had 990 here. Oops. Okay. 990. We had 99. We had 9. What was this? 890. 891. Okay, we had 8 here, 2 here. We had 893. Okay, so what's our negative predictive value? How many negative tests did you get? How many people tested negative? 893. How many of those 893 actually were negative? 891. So your negative predictive value was 891 over 893. Okay? Right? So that's pretty good, right? Got to be like 99.99 or 8%. Right?
All the way back up to when the body actual on the very first page.
Sure. Yeah, the false negatives are positives, right? In other words, the sensitivity is equal to the number of true positives, the people that, tested, would definitely tested positive, over the, yeah. So in other words, the people on the bottom are all the people that have the disease. So false, if you look at the table, the true positives and the false negatives are all people that actually have the disease.
Sorry, I was reading it as PN divided by PN.
Oh, yeah, I could have put parentheses around there, right? That would make more sense. Yeah. And it would probably make more sense to have parentheses around there too. Okay. Just like the people that tested negative are going to be the false positives and the true negatives. Right? True negatives because they correctly tested negatives, and the false positives because they're people that don't have the disease that tested positive. So this whole column represents, this whole column represents people that have the disease. This whole column don't have the disease. This whole column represents people that do have the disease, right? And this row represents everybody that tested positive. Some of them really positive, some of them don't have the disease and tested positive, and so on. So, but that's a good way to organize this, right? Makes sense. After you play around with it, it makes sense. You can trip yourself up pretty easily on the true positives and false negatives. You got to think about it a little bit. But I think if you play around with this a little bit, you get a little bit more comfortable with it over time. Okay, so I'm going to take that same test. I'm going to look at it a little bit differently. Let me get my pants here. Okay, so I'm going to summarize what we knew about this before. The prevalence is equal to 80%. Oh, excuse me, 20%. The specificity of the test is equal to 80%. Geez, 90%. The sensitivity of the test. Don't help when you get old either. It makes this even worse. Although to be honest with you, there's some of these things that just the nature of them is that like you just the more you do this, the more easily tripped up you are sometimes. Okay, so let's take a look at a couple of ways that I could describe this. So the prevalence is 20%. What's another way of saying the prevalence is 20%? Another way of saying the probability of having the disease, being disease positive, is equal to 0.20. That's the same thing as saying prevalence. Okay, so now the probability of testing positive, given that you have the disease, what is that going to be? That's the sensitivity. That's going to be 0.80. And the probability of testing negative, given that you don't have the disease, what is that? That's our specificity. That's equal to 0.99. Okay, good. So now let's do a probability tree. Okay? Our probability tree is going to start out with whether you have the disease or not. Okay, here's our probability tree down here. So I'm going to start out from here, and I got disease, or no disease. Okay? So the probability of having disease was what? 0.20, right? That's our prevalence. Probability of not having the disease is 0.80. So if I was going to pick a random person out of this population, I'd have a 20% chance of getting somebody that has the disease and an 80% chance of getting somebody that doesn't have the disease. Okay, given a person has the disease, what's the probability they test positive? Well, they could test positive or they could test negative. What's the probability they test negative? Well, that's the sensitivity, right? So that's going to be 0.8. What's the probability that they test negative? It's going to be 0.2, 0.20. Now, let's say a person tests negative. What's the probability that they're going to test positive? Well, first I'm going to start out with the probability they're going to test negative, because that I know. What's the probability they don't have the disease and they test negative? Well, if they don't have the disease and they test negative, is 0.90, right? And the probability the person not having the disease tests positive is going to be 0.10. Okay, so now if I multiply this out, probability of, there's four possibilities here, right? This first possibility is that the is going to be 0.2 times 0.8, right, which is equal to 0.16. And what is that? That's the probability of having the disease times, but maybe just put an X there, times the probability of testing positive given that you have the disease. Okay, sound right? Now, the next group here is going to be, let's see, that's going to be 0.2 times 0.2 is going to be 0.04, right? That's going to be the probability of having the disease times the probability of what? Let's see, probability that you test negative given that you have the disease, right? Everybody in these first two rows has the disease because they were up on this part of the tree. Just a question whether they tested positive or tested negative given that they have the disease. Okay, so let's go down here. Probability that, let's see, 0.8 times 0.1 is going to be 0.8 times 0.1 is equal to 0.08. Okay, that's going to be the probability of not having the disease times the probability of testing positive given that you don't have the disease. Okay? And finally, we got the probability it's going to be 0.8 times 0.9 is equal to 0.72. Assuming my math tables still work. Probability of not having the disease, probability of testing negative given that you don't have the disease, right? And times, I forgot, I should have put it up front, times the probability of not having the disease. Okay, so what do we have here? This is the probability you test positive and have the disease. Positive test and disease. That's the first one, right? Second one is you have the disease, but you test negative, right? Third one is you don't have the disease, but you test positive. And the last one is you have the disease, you don't have the disease, and you test negative. That's all the possible outcomes. Is there any other possible outcome you could have? No, right? So what would we expect all of these to add up to? 1. Okay, do they all add up to 1? Yes? I got a yes there? Okay. So let's add just to check. I'll check it. Yeah, they do add up to 1. Oh, good. Thank God. Okay, so at any rate, so let's think about this for a second. When we're talking about conditional probability, remember our conditional probability was the probability of having the disease given that you've tested positive, right? Disease positive, given that you've tested positive. So that's going to be a ratio. What's the probability? What's that going to be? Well, on the bottom is going to be all of the outcomes that satisfy having tested positive. Which of these outcomes represent having tested positive? That one does, and this one does. Well, how much is that one? That one's 0.16. This one is 0.08. So on the bottom of the equation, I've got 0.24. 24% of these outcomes represent having tested positive, right? Out of those, how many of them are people that actually have the disease? Well, there's only one of those that represents people that have the disease, one outcome, and that's the one that's 0.16. So 0.16 over 0.24, what is that ratio? Point two-thirds, 0.67, right? What was when we tested it before using that table, what did we come up with as a positive predictive value? Or in other words, our probability of having the disease if it tests positive? We come up with 0.67. We got the same outcome that we did before. That is our positive predictive value. We did it two ways, approached it from two angles, got the same answer.